The number of coronavirus deaths has climbed past 9,000, but the number of Iowans hospitalized from the virus is at its lowest in 6 months. 67% of Iowans have received at least one dose of a COVID-19 vaccine, yet still there's a lot of hesitancy over the vaccine. It's skyrocketed, in fact. Iowa lawmakers this session introduced a bill in the Iowa House that could ban COVID vaccine mandates. Our Griffin Wright joins us in studio this morning to show us how this represents vaccine skepticism in Iowa. Good morning, Griffin.
Good morning, Jody. When I spoke with Representative Kaufman, who introduced the bill, he assured me that the bill is a work in progress and its intent is to focus specifically on the COVID vaccine and not routine childhood immunizations. However, vaccine skepticism has been on the rise throughout the pandemic, and in some cases, it has spread beyond just the COVID vaccine.
I've definitely seen more vaccine hesitancy with the COVID vaccine compared to any other vaccine that I can remember in my career so far. And I think a large portion of parents, if they have concerns about the COVID vaccine, it's just about that vaccine. But what I have seen is maybe a slight increase in families and parents raising questions and having vaccine hesitancy about vaccines in general, which is a very concerning thing to me.
Dr. Waddell emphasized how the routine childhood vaccines are integral to keeping children safe. These vaccines protect against polio, tetanus, meningitis, measles, and other incredibly deadly diseases. Currently, the state requires all licensed child care institutions, including schools, to have children immunized against 4 to 9 of these diseases, depending on their age. They are also highly transmissible, meaning even a small dip in herd immunity can prove disastrous. Dr. Waddell has seen more pushback against vaccines during the pandemic and more questions being asked. However, he doesn't think it's a bad thing for parents to ask questions. It's just important they ask the right source.
I would encourage families just to reach out to the healthcare providers to talk about these questions if they have them. But these vaccines have been around for a long time. They are very safe, well studied, and they are a pillar of how we protect our children. It is one of the foundations of our society, how we keep our next generation safe and healthy.
Dr. Waddell hopes that as more information comes out confirming the safety of the COVID vaccines, especially for children, that parents will push back less against immunizations that could save their child's life.
Okay, really good information there, Griffin. Thanks for following up on that.